topic is the vesicovaginal fistulas. This is in front of you. So if you will consider about the vesicovaginal fistula, these are the type of the vesicovaginal fistulas which we have it here. The means all the whole, and which are the most important for our obstetrical point of view. The first one is the vesicouterine fistula. If you see there here, this is the uterus, and in the uterus to the bladder, this we call it vesicouterine. This is a connection between the uterus and the bladder, so it will be the bladder and the uterus, so we call it vesicouterine fistula. Then the another one is that vesicovaginal fistula, means in the bladder and the vagina there is a connection between the bladder and the vagina. But you please remember one thing, there is no connection between uterus and the bladder. There is no connection in the vagina. Okay, this is high up. So mostly the connection is from the uterus to the bladder. Okay. So the second one is from the bladder to the vagina, and third one is the urethra to the vagina. So it will call uretrovaginal fistula. So these three are the most common one. Okay, please remember this one. So for our point of view, our important for the theory point of view, this is the second one, vesicovaginal fistula, VVF, which we call it. Okay, so what we have to know about the definitions of this thing, sorry, oh my god, I have to make, okay. So the first one we have to know about the classification. Classification depends upon the size. Okay, size of the sorry, 1 second. Okay. Okay. So what we have it, the classification of VVF. What is the classification? Depends upon the size. Okay, in the majority will be there. What it is, a simple fistula. Simple fistula means non-complicated. It will be less than 0.5 centimeter in size. This is the call simple fistulas. Then another one is called the complex fistulas. Complex fistula means if she has a previous fistula, they done the surgery for her, repair surgery. Okay, and then a large fistula in the size. So what we have according to our classification, two type of fistula, simple fistula and the complex fistula. Finish. Okay, but the one thing we have to remember this thing here, that fistulas are not common. Okay, they are there, they are rare but not common. Okay, this that for the theory point of view we have to understand. Okay, what the fistula is causing, the problem is causing what they will cause, high morbidity. See, what is the meaning of morbidity? Please understand the meaning of morbidity. Morbidity means problem they are causing. Okay, what they are causing the problem, we understand, we will understand down stairs. So he said there is a high morbidity, highly they will cause the problem. What is the problem? The urine is coming outside, so the patient will feel embarrassment, they will start the UTI, the vulva vagina will be red, inflamed, all the time she is feeling the pain, and sometimes the other social problem she will start to get it there. And the problem is that urine all the time is coming, so urinary problem she will start to have it. This is called the morbidity. Okay, this okay, now we have to understand mortality is also there. Please remember, mortality is rare but high morbidity is there. So this is MCQ question, that VVF causing high morbidity and small mortality. Mortality is small or a rare we can say, but the morbidity is high. Please remember this word. Okay, other what we have it there, there is two type of countries in this world. One countries are the rich countries, one countries are the poor countries. Okay, so we are living in the poor areas, and in our side, in the poor countryside, which we call it developing countries. In developing countries, what is the most important complication of the childbirth is the obstetric labor. Okay, obstructed labor, afterwards they will cause the VVF. Obstructed labor, it is causing the VVF after prolonged obstruction, prolonged obstruction. Okay, and the developed countries, the rich countries, what this VVS is uncommon. Please remember, remember, remember. Developed countries VVF is uncommon. Okay, and if they will develop the VVF, it will develop after any surgical intervention, any surgery. Okay, like any surgery they will develop the VVF, but the first one it is common in poor countries, developing countries. So this is your very important MCQ question. Okay, don't forget that one. Now the risk factors. What are the risk factors? Just so first you have to remember what is the how they will present. The MCQ will be there that 35 years old lady, she has a obstructive labor, and after delivery of the labor delivery she present after 1 week with the complaint that she is having a continuous flow of the urine, she cannot control. So what it will be, it can be urinary tract infection, stress incontinence, overactive bladder, or any fistula they can give to you. So you have to choose fistula. It is fistula. How you will choose? Because she is developed countries, obstetric labor. This complication we have means our point, golden point which we have it, and continuous urine. So these are the 3 points which will tell us that it is a fistula. Okay. But if they told you that she is having a history of the urinary tract infection and investigation shows that she has nitrite leukocytes, then it will go to the UTI. If they give you the scenario, the option they told you that okay it will be a, then it will be a UTI, my friends. It will not the fistula. Okay. So okay, what are the risk factors? Risk factors means she has a height is less than 150 centimeter, weight is also low weight. Okay, less than 44 kg. Okay, and early marriage or early start of the sexual life, this is also one of the risk factors. And in mostly it is in the primary gravida, these are mostly in the primary gravida. But in multigravida, how the VVF form, it is formed in the after the cesarean section. After cesarean section it is 4 times more common. And what type of fistula after cesarean they have it? This is called high tract fistula. High tract fistula means what? See here, what is we have it here? It is the bladder. Sorry, it is the uterus. A is the uterus. Second is the bladder. So what is happening? Bladder, we have 2 ureter, isn't it? So when we are doing the cesarean here in the uterus, so we can damage to the ureter. So this is called the high tract fistula. Clear or not? Hello, my friends.
Yes, clear. Yes, clear, clear, mom. Yes, clear, clear.
Okay, okay. So what we, I'm making it the recording. Inshallah, I will try to put it in the our group. Okay. So try to in the group I will put inshallah. So they have a high tract fistula. Please remember, after cesarean they have a high tract fistula. What are the other risk factors? Maybe patient is very obese. She has a fibroid operation. Okay, and then she's any operative vaginal delivery, and the most important things commonly in the old age is neglected pessary. Okay, neglected pessary means that she is not removing the pessary, so it will cause the fistula. And tampen, some women they will use it. And during the surgery, you know what type of fistula we are making it, we are injuring the ureter during surgery of the cesarean section. It will be a crush injuries. We will clamp the 2 types we have it, the crush and the clamp. We are clamping the ureter or we are crushing the ureter. So these, please remember this thing. This is a very important MCQ question, that during the cesarean section we will do the injuries, fistula formation by the crush and the clamp. Okay, mostly the crush. So what we have it here? So we done that one. Afterwards, what we have, what is the most important point? Impact. What is the most important complication they are going to have? She can have a mortality. See here, Fistula associated with maternal mortality. There is a maternal mortality. There is a, we cannot say there is a death here. A maternal death account 22% of all morbid maternal conditions. So how many percent it is? 22%. Please remember that word, 22%. It will cause a woman to die. Okay, how the fistula will make the woman to die? Because the urine will come, and maybe she has a urine coming in the abdominal cavity, so the abdominal cavity will start to make the urema formation. Then because this is acidic fluid, this will cause the complication in the organ problem. So that's all the complication she has it, then she can die with this complication. Okay, remember that thing. Okay, if there is a successful repair after surgery, it will improve the quality of life, like her mental health, physical health. Okay, now the management. What are the management? Management is it. Management will do according to the size of the uh, fistula. Okay, and the conservative management is there, and surgical treatment. There is no medical treatment. Please remember there is no medical treatment for the fistula, only the conservative and the surgical treatment here written. Okay, so what we have it here in the management, the conservative treatment, what we are going to have it in the conservative management. Here the conservative management we have here conservative management. If the fistula is less than 1 centimeter, we are going to put the catheter, and catheter how many days we are going to put it? 12 weeks. Please remember, this is very important MCQs. Though for the conservative management of the fistula, catheter can be put for 12 weeks, 20 weeks, 10 weeks they can give you, but you have to remember it is 12 week, maximum 12 week, minimum. So not maximum, minimum 12 week. Okay, so we'll first, the conservative management is the 12-week catheter we will put it. So it will the area which is make the fistula, the this area 0.5 centimeter or 1 centimeter, it will be conservative with catheter formation. Catheter means we'll put the catheter drainage, then it can make the fistula to go away. And the success rate of this one is 67 to 100% if his fistula is less than 1 centimeter. Please remember this figure for your this one. And we can also use the anticholinergic drug during that conservative management. After putting the catheter, we can give her the anticholinergic drug. Why we are giving the anticholinergic drug? This is without catheter we will not give the anticholinergic drug without catheter. It has to be with catheter. Please remember, with catheter. Okay. And they say that after we will this vaginal passages, neglected passages. So neglected passages, mostly the fistula is bigger, they found it, but they mostly they will put they will wait after this one 3 to 6 months after the injury. Okay, and then they will put the catheter, indwelling estrogen cream, then they will go for the surgery. And what are the name of the surgical treatment? Just remember the name, don't go more than that one. There is two type of surgical methods which they do it. The route they will ask you. Okay, the timing they will ask you. Timing, if within 24 hours she has we discover the fistula, we will go for surgery. But after 24 hours we will not go for the surgery, we have to wait. Okay, if it is less than 1 centimeter, 12 week we will put the catheter. If it is more than 1 centimeter, more than 2 centimeter, we will go for surgical method here, surgical method. Okay, what we will do, we will excise the fistula, and will excise the fistula by transvaginal, transabdominal, and these are the routes. And now they also put the robotic surgery, laparoscope with robotic surgery here. Here they will open that fistula. Okay, they are making clear of the fistula, and after clear of the fistula, sometime they will put a ring so that it will not become bigger and then they will stitch that area. That's all. This is called the open or surgical or transabdominal, whatever technique they will give it. But the another technique it is this called this laparoscopic extravesical technique. Okay, laparoscopic extravesical technique. In this, what they are doing it here, the fistula is there, vesicovaginal fistula. They will clear that area, dissect that area, and then they will put a stent, or they will put between two holes, they will put the stent, and then they will stitch that area. That's all. Clear? Hello?
Yes, ma'am. Clear.
I'm sorry, because when I'm talking to you, I'm trying to get that one, the one.
Yes.
I'm not getting it. Please, sorry for that one. This
Yes.
fistula
But
question.
I have
Okay.